So the first speaker is Dr. Len Bracewicz. I've worked with Dr. Len for 20 years now. He is one of the most unique speakers you're going to hear. He's got a background of traditional pharmacy. He transitioned to a natural pharmacy. He was one of the first people on satellite radio. He was syndicated throughout the nation. He's been on podcasts. He's run a natural pharmacy. He's an NMD, CCN, and he has a very unique ability to combine allopathic with conventional, pharmaceutical, and now natural wellness and functional medicine. So he knows all sides, and he's going to present some fantastic case studies today. So let's give a warm welcome to Dr. Len Bracewicz.
Thank you, man. Can you hear me okay? Yes. All right. Just a couple opening comments before we get started. When Jamie asked me to do a segment on optimal men's health, I said, Jamie, do you want me to do just a whole thing on Viagra? Is that what you want me to do, or is it just the testosterone thing? And as I put together a presentation, I realized a couple things. And my wife's in internal medicine, and she just retired last Friday. So one of the things that she told me all along, she said, in her 30 plus years in internal medicine, there's not much difference between a man and a woman. The hormones are different, but structurally we're the same. So she said, if you're going to do this presentation and do it correctly, you need to take a look at all of the aspects of keeping a person's optimal health, male or female. So you're going to see some statistics in here. We're going to break this into two sections. You have a copy of the original slides that we're going to go through rather quickly. And then we're going to do another set of handouts. The current state of men's health. There's about 20 little slides. We're going to go through these. These are for you to take back with you. This is from a syndicated group called the Men's Health Network. You'll be getting this in a little bit. This gives you up-to-date statistics, men versus women. First slide, and I'll open up with this. In all the cases so far of death in the United States from COVID, 200,000 we just hit. More men or women? 2-to-1 men. 2-to-1. Almost 3/4 of the deaths have been male. So put that into perspective as a little backdrop when we talk about optimal men's health. My wife also handed me these as I went out the door. I haven't put these in. I've read them once, and she said, you've got to open with these. A woman didn't come home one night. The next morning, her husband asked where she was. She said she decided to sleep over a friend's house. The husband calls 10 of her best friends to see if that was true. None knew anything about it. A man didn't come home one night. The next morning, his wife asked where he was. He says he decided to sleep over a friend's house. The wife calls 10 of his best friends to see if that was true. 8 of them confirmed he slept over. 2 of them claimed he was still at their house. Patient started complaining of headaches. Went into the doctor. The patient's family gathered to hear what the specialist had to say. Things don't look good. The only chance is a brain transplant. This is an experimental procedure. It might work, but the bad news is the brains are very expensive and you have to pay the cost yourselves. Well, how much does that brain cost? Asked the relatives. For a male brain, $500,000. Female brain, $200,000. Some of the younger male relatives looked shocked, but the man nodded in understanding, and a few actually smirked. Then the patient's daughter asked, why the difference in price between a male brain and a female brain? A standard pricing practice, said the head of the team. Women's brains have been marked down because they're used. Lastly, now these were my wife giving me these. A young man was walking along one of the Southern California coast with his surfboard. He suddenly spots a bottle which recently washed up in the beach. It's obvious it's been tossed around for a long time. He picks up the bottle, notices it has a cork, curious, opens up, and up pops a genie. After expressing profound appreciation for having been let out of the bottle, the genie grants his benefactor the classic one wish, and it'll be yours. Being an avid surfer, it didn't take him long to say, I've always wanted to surf Hawaii, but I get seasick on ships, and I'm afraid to fly. Would you build me a bridge to Hawaii? The genie replies, do you know what you're asking for? Do you know how long that bridge would have to be? Think of the enormous challenges for that undertaking, the supports, the cost, the concrete, the steel, and the maintenance of that bridge. No, think of another wish. Man said, okay, try to think of a really good wish. Finally, he said, I've been married and divorced 4 times. My wives always said that I don't care and that I'm insensitive. So I wish I could understand women, know how they feel inside, what they're thinking, and then give me the silent treatment. I want to know why they're crying, know why they want and what they really say nothing, know how to make them truly happy. I really want to understand women and how they think. And after a long sigh, the genie responds, would you like that bridge 2 lanes or 4? So with that start, we're going to talk about optimal men's health. I'm going to try to go through these slides pretty quickly so that we can get a feeling. This is where my office is in Peachtree City, Georgia, just south. I just recently, 3 weeks ago, relocated here to Tampa. So my home is here, my office is there, 380 miles apart. But I'm still taking care of that office, doing almost everything virtually now, which has been really a nice help. Headlines, obesity has more than tripled in the last 10 years. Prostate cancer is up 67% in the last 10 years. Andropause is now accepted as a real issue. You know, if you go back literally 3 years ago and you went to a urologist or an endocrinologist and you said, as a male, there's something going on with my hormones. That term was not accepted in the medical community until 3 years ago. Testosterone levels have decreased each year since 2000, and if you really study testosterone production, true physiological testosterone production that starts when you go into puberty as a male and stays steady state for the entire course of your life. It never drops, unless it's going somewhere, unless it's being utilized incorrectly. So when we've seen testosterone levels decreasing every single year, up through and including 2019, 1 in 5 men are now dealing with depression and anxiety when we really didn't have that as even a diagnosis 10 years ago. Men didn't go to doctors and say, I'm dealing with depression and anxiety. Male cancer, all-time high, 2019. More cases of male cancers than at any other point in history. Asthma in men has increased almost 250%, including the fact that the majority of men have quit smoking. But asthma levels continue to rise. U.S. has now dropped to the 11th in world life expectancy. U.S. leads the world in infant mortality. Now, it's intriguing. When we get these slides, you're going to see on here the current state of men's health. And this came from 2014 that said a man's estimated lifespan was 78.2 years. In the last 4 years, and I just checked it out this morning, CDC data, we've now dropped 2.5 years in life expectancy in the last 4 years. Something's going on dramatically with men's health, which is, again, why I focused this presentation on some very particular factors that you can actually apply to men and women both. U.S. leads the world in all forms of cancer except 2. Any ideas which one? Cervical cancer and stomach cancer are the only 2 that the United States has the highest rates. We lead the world in obesity. If males in this country decided to improve their health as well as the health of their family, it needs to start now. If we concentrate on testosterone only, we'll miss the mark entirely. So, the fork. I've talked to a lot of you prior to this to say, okay, all of what you said, Len, all of the last 4 years, 10 years, 20 years, what has changed? Right there, our food, our primary food. Are we eating too much, too little, not often enough, the wrong percentages of food, and the quality of food that we're getting? It is, and as a board-certified clinical nutritionist, and looking at the adaptations of food toward health, I've seen a dramatic change in dietary habits. And it hasn't gotten that much better. I'm going to go through these real quick. Controllable factors, the phenomenon known as aging is a result of a number of pathological changes. Prolonging healthy lifespan, we put ourselves in a position to take advantage of future medical breakthroughs. Hormones play a critical part in aging. We all need to feel healthy at all times. I know I'm preaching to the choir because most of us do what we need to get to that point. Now, coming from my background in pharmacy and being inundated in traditional medicine for decades, Jamie asked me, once again, as you did this presentation and you're talking about controllable factors, we're going to talk about 15 of them very quickly. How do you feel natural approaches work compared to pharmaceutical approaches? In other words, if we're going to fix these things that we're talking about, can we do it more effectively or less effectively using a natural approach? And I said, Jamie, literally 92 to 93% of what I'm going to talk about can be controlled and put into its place using natural therapies. There are still those few, the genetic links to some disease states that can't be controlled that way. Some of the mechanisms of aging, when we look at this, degeneration, inflammation, nutrient deficiencies, the world we live in, spiritual, emotional emptiness, pathological changes, drug, caffeine, nicotine, etc., and drops in hormone levels. All of those, you can nitpick any one of those and do an entire seminar on those. But every single one of those are mechanisms that affect both men and women both. So these are the categories we're going to talk about. How do you delay the onset of aging? Can you do that? Can you keep yourself healthy? We broke it down into 15 sections. We're going to go through each and every one of these, including a little discussion I had before, who invited the cow to the table. So we're going to finish with that part, and then we're going to talk a little bit more about these handouts. Chronic inflammation, who started the fire? There's an epidemic in this country of inflammatory diseases. Arthritis, brain cell degeneration, arterial wall thickening, heart valves going bad. All specifically related, including the testing that we can do, to inflammation in the body. Heart attacks, strokes, and Alzheimer's, all linked to inflammation. HSCRP, one of the most critical, highly specific CRP, one of the greatest blood tests that you can do for a patient to find out if there is any cardiac link due to inflammation that can be leading to a future problem. In other words, is inflammation the root of all disease? Chronic inflammation, slow, long-term, inflammation lasting for prolonged periods of time. A lot of things such as infection or injury can be related to those. We know inflammation from redness, swelling, heat, etc. This is a copy of a 2006 cover of Time magazine. 2006, not a medical journal, that said the secret killer, the surprising link between inflammation, heart attacks, cancer, and Alzheimer's. 14 years ago. Time magazine, one of the best articles I've ever seen that did not appear in a medical journal. When we looked at, again, inflammation is number one in that list of issues that are going on. When we look at something that is going to be well done, that can reduce pain and swelling, increase mobility, and modulate the immune system, it's one of the few products out there that if we lower inflammation substantially, looking at the ingredient list, ask questions about this, one of the best and most effective tools that I've used over the years. I typically will start somebody at a high enough dose. I'll typically almost double the suggested dose. I'll go to 3 capsules twice a day. Jamie once told me, how do you dose this thing? You dose it as high as you need to get the relief, and then you can pare it back down. So instead of ramping up on some supplements, this happens to be one that could easily be used at a higher dose, reduce the inflammation, and then move on to a lower dose later. Glycation. This is problem number 2. We call this super glue. It's a chemical reaction where sugar binds together. You know, we talk about, is it creme brulee? When they actually put sugar on top of a dessert and then they put a torch to it, and the sugar glycates. Or you can look at aging spots that people get as they get older. Don't look at my hands. If you can, you can see it. That's actually lipofuscin, which is glycation that's taken place in the melanin layer of your skin. The real problem with this is you get protein molecules that will bind to glucose, forming non-functioning structures. probably one of the most common links to senile dementia, which is now again at an all-time high. Stiffening of the arterial system, including eye degeneration. So when you look at glycation, it's one of those problems that if we start producing what are called AGEs, or advanced glycation end products, the development of vascular problems, especially in diabetics, comes to the surface. When we look at neuropathy and nerve ending damage, we look at kidney failure that takes place with diabetics. We look at eye degeneration, which takes place with diabetics. All of those being linked to glycation, which is again something that can be, there's a picture of a steak, put it on the grill, heat it up, Ruth Chris Steakhouse, marbled steaks, the levels of sugar inside of those striations that get fried and release the sweetness to the meat, but that's glycation. And it's been proven over and over again too, that if you cook meat too long on the grill, you can actually put advanced end products, glycation end products, into our bodies and can become a precursor to cancer. And again, if you're looking for something as simplistically as we can get that is going to solve glycation, it's micronutrients. And looking at things like Frontier Multivitamin. And when you look at this, and I've done this before with my patients, well, I'll have a copy of the ingredient list from Centrum or one of the other products compared to this. Or when you'll find people taking multiple B vitamins, some fruit and vegetable supplement together, you put something like this together in a simplistic way, 2 capsules twice a day. I've had people go down to 2 a day as a maintenance dose, but in most cases, 2 to 4 a day. Feel the energy that comes with that. This is the newest entry into the world of products with Nutritional Frontiers. And this one has really stormed, and I'm sure you're going to hear more about that this afternoon. But the Women's Complete, which gave you a lot of different products inside of here, which literally can help balance hormones. When you look at what's inside of here, and you look at some of the ingredients, GTF chromium's inside of here. You look at choline in the bitartrate form, again, crossing the blood-brain barrier. You look at a probiotic mixture that's within there. You look at a superfood blend that's in there. So you see a lot of things that can literally help female hormone issues. So I've been using this primarily past the age of 18 in most females. This has been my go-to. And I'll use it up through and including through menopause and to the other side. Point number 3, DNA mutation. We call it transformers. Caused by numerous synthetic and natural compounds can cause cancer to form. Aging cells lose their DNA gene repair mechanism. Cells proliferate out of control. Is it repairable? If we say that DNA, and we've all seen these, which is duplication and inversion, all of the different DNA replication processes. I'll give you a prime example. It's now 9-year cancer survivor. I had kidney cancer, stage 4. Yay. And when we looked at the genetic material, when I had them do a genetic material sampling of my kidney, I still have my kidneys, by the way. We went through an experimental surgical procedure to remove the tumor. It was an 8.7 centimeter tumor that has now been linked to ultraviolet radiation. It was DNA changes in the material of my kidneys, and then when I look back in time, I did tanning beds back in the day. Because if you're going to wear a Don Johnson jacket, you got to be tan. So when we look at a gene mutation, we're concerned about it being a permanent change. DNA, RNA, and something that was going to change the sequencing. We're going to go into this a little bit more in a little bit, but this is a chart that talks about the production of glutathione in the body, starting with methionine in the various tiers down. Now, we put this chart up here because one of the most common genetic alterations happens to be the MTHFR gene. Tracy has lectured literally entire seminars on this becoming a problem. We found the link to this at least we believe it has been, since we did fortification of white grains in this country. 1978, we added the enrichment to grains, we added folic acid. It's still in place today. And if you follow the European view on world health, you'll find that they just had a big controversy in England on whether or not to enrich grains. They never have in England. They never have, but they looked at the statistical data of what's going on here, where we have almost 10 times more patients with this kind of a gene defect that can't metabolize folic acid compared to Europeans. So they actually voted it down and said, no, we're not going to do that. Even though we know folic acid is a necessary nutrient, we're not going to do it. We're not going to mandate that it has to go into grains. So again, the controlling part of this, which can lead to a depletion of glutathione in the body, which can lead to brain dysfunction, neurotransmitter difficulties, you see that up in here, repair with phospholipids, but right over there, that's where your DNA and RNA is transferred, right at that step. Methionine, S-adenomethionine, and that's where the DNA and RNA go. So if we're able to metabolize and methylate folate properly, we don't run into the problem. Point number 4, mitochondrial energy depletion. I heard one of the fellows back here asking, what do you all have in the product line that can help with this? If we know that we call it running on empty, the mitochondria being part of every cell in our body, it's the energy powerhouse. It requires a complex series of chemicals and reactions to take place. We need to transport nutrients through the cell membrane. We need to purge out cell debris, which is again one of the roles of glutathione. Congestive heart failure, muscle weakness, fatigue, and neurological problems are all tied to this kind of an issue. This is where CoQ10 and a lot of the essential nutrients come in. This is an electron microscope view in the inside of a cell. This is actually taking a look at the mitochondria inside of a cell. This is an artist's conception of what goes on. The difficult part is getting nutrients to cross through this, and there's a very tight mechanism inside the mitochondria that does not allow for accumulation of debris. So as this part forms adenosine triphosphate, the ATP that we need to live, there has to be a way for it to get out and to purge out the excess waste. And that gets back to that last slide, where glutathione kept at a high enough level can help you to purge out that debris out of the cells. Once again, one of the easiest ways to put together, do you want to use CoQ10? Do you want to use this? Do you want to use them separately? Super B Complete, we call it here mood support because it is supporting the production of neurotransmitters in the body. But it's also one of the key nutrients to get into the mitochondria to allow for proper adenosine triphosphate production. Falling in the heels of that last slide, a methylation deficit, we sometimes call this the extreme makeover. Cellular DNA requires constant enzymatic action or methylation for maintenance and repair. One of the most simplistic things that we tend to overlook is the simple fact that aging makes it more and more difficult. Every year that we age, it's more and more difficult to maintain methylation. The older that we get, past the age of 40, we start to have more and more difficulties with methylation. So pay very close attention, doing the testing. It's a simple swab of the inside of the cheek or collecting a saliva sample, sending it out to a lab, and let them do an analysis of whether or not there is a methylation problem. DNA damage leads to, there was me, cancer, liver damage, and brain cell destruction. One of the chronic links that we're seeing with the rises of Alzheimer's in this country. And there's that chart again. Glutathione synthesis in the brain is dependent upon hepatic cystine synthesis and export. So that's the same chart. Let me go back to that again. Now, the crucial factor that comes out of this slide, almost 80% of the glutathione in your body is stored in the brain. Nearly 20% is stored in your lungs. When Jamie came up with the Corona pack initially, one of the ingredients that we put in that pack was N-acetylcysteine. You can come down here and see cysteine right here. And when you put N-acetylcysteine, you're bypassing this, you're adding an immediate push to glutathione levels in the body. Still been proven that corona is entering the body through different ports, through what are called ACE2 ports, primarily through the base of the lung, but we're now finding them in the upper sinus passages. So when they said, and they've been trying to do investigations about why African Americans are being affected so much greater. Originally it was hypertensive, diabetics, and obesity, but now we're finding there's a different environment in the sinuses of an African American compared to a Caucasian. So there's a different environment here. There's more ACE receptors in an African American sinus. So again, a good point to make sure those masks, when they're being worn, cover the nose as well, because that's a great port of entry. There's N-acetylcysteine, helps with the immune system, detoxification, and respiratory. You know, people have said, do your opinion on this COVID thing, do you really feel it's a real thing? Is it really something? I can't deny that it's something, but I think if enough people took good care of themselves and especially protected the lungs, if we were just able to give everybody this particular prep, I think you would have seen the death rates drop by at least 50%. Nothing to base that on except the fact that if you look at this and you do a high enough dose of this, I use typically myself 3,600 milligrams a day of NAC. And it's what's keeping my kidneys at full functionality now so that I don't have to go back and revisit what I went through once. Buffered C is the other new entity. It's a relatively new product for Nutritional Frontiers. Again, calcium ascorbate, a different entity than just straight ascorbic acid. I've used this probably longer than any other product that I've ever taken. I've used the joke many times that if I was ever stranded on a desert island and could take only one supplement that would cross more barriers, this would be the one. As far as an immune boost goes, as far as alkalizing the body, this one by far. 2 to 4 to 6 grams a day for most individuals, especially with men going up to the 6 to 8 grams a day dose. Fatty acid imbalance, time for an oil change. Essential to maintain cell energy output, aging causes alterations in the enzyme required to convert dietary fats into essential fatty acids. One of the tests that I love to do with my patients is a fatty acid analysis. It's a whole red blood cell analysis where we can find out what's being attached to red blood cells. I use the Boston Heart Labs a lot. They do, and they can't accept insurance billing from most patients. They can do an EPA level, a DHA level, an ALA level, as well as a trans fat level, a saturated fat level, and an unsaturated fat level, so that you can get a good picture of what somebody's diet has been like as far as oils go and good fats go toward their total health. Now, we do it as part of a cardiovascular workup, but it can really give you a good insight into how somebody's been eating, because when I do that and I get a high level of saturated fat, I can look them straight in the eye saying, how much red meat are you eating a day? And in most cases, you can flesh that part out and show them specifically about why that gets to be a problem. The results here of imbalances in fatty acids, irregular heartbeat, joint destruction, low energy, hypercoagulation, dry skin. Is it a blood thinner? No, but it makes the blood less sticky. I'm finishing up a study at Piedmont Hospital in Atlanta in the cardiovascular wing, where they have now been using 2 different principles in studies. When they're going in to do cardiac surgery, stop your fish oil a week before, right? That's been the gold standard. They had a few people that just ignored that fact and accidentally took double dose going into the surgery. And what the doctors found when they started doing some inquiries is those that took the higher dose going into a surgical procedure bled less and recovered twice as fast. So the statistics that say stop this beforehand is not bearing any weight. So we're going to have that report, I'm hoping by the end of the year. It should get published in JAMA, and it's going to be a breakthrough, in my opinion, as far as omega fats and really not being necessary to stop those things prior to a surgical procedure. But again, every case should be looked at individually. You have a copy of this in here, and this is just a great little chart that I've used to show people individualized about, if you look at, and you can get up here to look at olive oil right here, and you look at this 75% here of monounsaturated fats, and you can compare that to canola at 61%. But when you look at, again, what we're looking at is monounsaturated fats, nothing touches olive oil. But then when you look at saturated fats, look at coconut oil, 91% saturated. And again, a lot of benefits to coconut oil, coconut milk, etc. But you got to be very cognizant of the fact that the saturation point within a lot of consumption of coconut oil can really end up becoming a cardiovascular risk problem. One of the things that, how can you tie in? Can you do a chart that says, if I'm consuming enough good fats, is it feeding the natural production of testosterone in the body? The one thing that we have found is, because of the breaking down the stickiness of the blood and getting blood circulation to the testes, that we did see a bump when we did it over a period of time of about 30% increases in testosterone levels by maintenance of. In fact, I found it on all hormone levels. So if we have somebody that is super deplete, let's say in progesterone going into menopause, we can use that same concept again to build up more hormone levels in the body. So it doesn't fit into a chart that says testosterone comes from dihydro or DHEA on down, but it does support the fact that the increased circulation and the unstickiness of the blood can improve the natural production of testosterone in the body. Omega-3D, brain health, blood pressure support, cardiovascular health. This is an important one. How many times, and I'm sure a lot of us that carry biotin sell a lot of biotin, and I don't know about you, but I haven't seen very much with biotin actually helping with hair loss. But when we look at using enough of the fish oil again, you're finding that hair and skin improvements dramatically improved. Hormone support, joint and bone health. And again, what I like about this in particular is the breakdown of EPA to DHA ratios. So when you look here and you look at the 960 to 640 ratio, you typically will see a 960 to around 400 ratio in a lot of products. This has a higher DHA content and gets us, we say 900 milligrams. When it's actually tested, it's actually testing it out a little bit over 1,000 of EPA and DHA together. So this is delivering a tremendous amount. And I have yet to have a person complain with burping and having any kind of difficulties whatsoever. So this is an extremely clean, well done, well filtered, and well processed product. Point number 7, excess calcification. One of my patients came in, a fella walked in, a 41-year-old pilot for Delta. And he just had his blood work done by his doctor and said his testosterone levels were low. Low end's 180 on the scale when you do blood work. He was at 210. And the doctor could not put him on testosterone injectables because he's a pilot. It will show. So he came in saying, I want to buy something to boost my testosterone. Now it's real easy just to say, here, take this. But we took a look at his particular situation, and he brought up his blood work on his phone. I had him on a conference call. He brought up his blood work, and I said, go to your blood sugar levels and go to your triglyceride levels. And he said, what's that have to do with testosterone? I said, go there first. His triglycerides, his total testosterone was like 202, nothing extravagant, but his triglycerides were over 400. And I said, there's a problem there with blood sugar metabolism that's going to be interfering with testosterone production in your body. He also showed on his blood work that his estrogen levels were on the high side of normal. So we used EstroCleanse with him, and we put him on Omega-3D, and I have him on 3 capsules twice a day for 2 weeks, and then we're going to go down to 2 capsules twice a day till we get a recertification of his numbers. We're going to redo his numbers in about 6 weeks. lower triglycerides, the body has the natural tendency to make more sex hormone. Excess calcification. Calcium ions are transported in and out of cells through the calcium channels in the membrane. Aging equals excess infiltration into the cells in the brain, heart valves, middle arterial wall. The newest test in the field of cardiology is a calcium scoring, where they're actually finally recognizing the fact that the mishandling of calcium in the body can actually precipitate calcium on the outside of the arterial wall. So there's a new test where they give you a radioactive dye and they do a quick CT of your chest, and they can find a degree of calcification that won't show when they do a heart cath. This is going to be on the outside of the arteries, which is going to make the arteries stiff and unpliable. So again, here's the conundrum with this. Most of the patients that go in for this test are on a statin drug. They're on Lipitor or Crestor, one of those. They've already had a heart cath and they've suspected something and they put them on this. They still were having chest pain. They go in and do this calcium scoring and find out it to be relatively high. The conundrum here is statins contribute to the calcification on the exterior walls of the arteries. So the doctors are in a real hard time and they don't want to do this test because they would have to discontinue the statin drug because of its contributing factor. But again, if you do run into somebody with excess calcification, if they came in and said they had a calcium score, which typically should stay 20 or less, if it's above those scales, the vitamin K, the Super K Plus, I have my wife actually on that, and in fact, it makes a huge difference. So the vitamin K will help to get rid of the excess calcification and can really help break down arteriosclerotic plaque. Calcium supplements now linked to a higher risk of heart attacks. I'm sure most of you have seen that. You know, for years we told women 1,200 milligrams of calcium, 1,200 milligrams of calcium. You need to do that. Calcium citrate, oyster shell calcium, whichever. Now we're finding anything higher than 400 milligrams can be contributing to that excess calcification on the arteries. This is where the importance of vitamin D comes in, to make sure that the patient's vitamin D levels are maintaining on the blood work, the 25 OHD levels, maintaining above 60. Doctors seem to get paranoid if we get the vitamin D levels into the 70s or 80s. That's actually a very good goal to try to get somebody there. Whether it's 2,000, 5,000, or even 10,000 IUs a day, extremely safe. 1,000 milligrams equals a 20% increased risk. So again, 1,000 milligrams of calcium, 20% increased risk of problems. That's, again, an electron microscope of the calcification that's taking place. That's the pink here. It's taking place on the tissue, making the tissue less pliable. I had this one cardiologist tell me that this is the equivalent of having a garden hose out in your yard that you left out year round. When you bought it, it was soft and pliable and I could easily water my flowers, etc. I left it curled outside through the winter, and the next year, the outer surface of that hose, even though the inner surface is still working, that outer surface becomes brittle and can actually crack. So when you go to use it, it will tend to bend together and stop the flow of water in the hose. Same thing can happen here. This can be a contributing factor, a major contributing factor that the need to be stented. So you see how many patients going in for a heart stent. Super K2 Plus, bone structure, density, integrity, proper bone remodeling, calcium utilization. So when we're down to that lower dose of calcium, let's say 400 milligrams a day, this helps you to utilize that at a much higher level. Improves cardiovascular functioning. And safe. Well, we have a deficiency of K because we're not eating the foods that are necessary to really supply K. You know, we see it coming from spinach, we see it coming from liver, etc. Most times we're just not getting enough there. And really, when you look at what vitamin K is doing, not just affecting blood levels, but it's also working on a plus-minus electric charge, which is allowing for a disruption of the calcium from precipitating and attaching itself, sort of like a Velcro effect to the outside of the arteries. So when you use the vitamin K, it disrupts that. so that the calcium does not want to adhere like it once did. So the body can then work on just getting it out of the body, getting it out of the bloodstream, and helping the body to excrete it. It also works at the kidney level to help the body excrete off the calcium. And again, I've used this dramatically with patients that were tending to have kidney stones on a regular basis. This can help to disrupt that so that we don't get the precipitation within the kidneys as well. Okay? Hormone imbalance. Hormones act to synchronize the function of all chemical signals, can lead to depression, osteoporosis, coronary artery disease, loss of libido. I still prefer saliva testing compared to any blood testing. Estro cleanse. I'll go back to that airline pilot that came in, and I said his estrogen levels were higher than normal in comparison to his testosterone levels. So what was going on is his body was taking his testosterone and doing a conversion into the estradiol, the E2 form. Estro cleanse. Big workhorse here, diindole methane, indole 3-carbinol. Those two together, along with what's the other, green tea extract, the curcumin, can work to help the liver get the entity out. Now the real critical thing is when you're using Estro cleanse and your body's going to it's going to work very diligently to get rid of any excess hormone, you got to make sure that you're using sufficient probiotics. So when you have somebody on this, we got to have a higher than normal dose of probiotics, because what the body's going to do is excrete this back down into the gut, into the microbiome. The body then has a chance for reabsorption, and you have to be very cognizant of the fact with enough probiotic in the gut, you will desensitize that hormone and allow it to be excreted in stool. Okay, so you want to get rid of it. You want to make sure that the body doesn't reabsorb it back into the system. So Estro cleanse twice a day. Probiotics, if I'm having somebody on this, I'm going to the standard probiotics at 2 twice a day. I'm going to a higher dose to make sure that the body can excrete this properly. PSA, again, your go-to to lower the body's conversion of testosterone to dihydrotestosterone. You want to try to block that pathway. That's another spot where the body will start to lose its testosterone levels. Again, swelling of the prostate gland, the potential of leading even toward prostate cancer, which again is at an all-time high. So again, a very good prep, much better than just standard saw palmetto. It gives you all of the ingredients, including stinging nettles and pygeum, 2 critical factors right here at the end, along with the diindole methane that can help dramatically in stopping that conversion. You can actually use this as a backdoor way of raising testosterone if the person does need a simple push to get his testosterone levels up. But with the average man past the age of 50 now having a swollen prostate gland, this is like a no-brainer for any of your patients that go to that point. This is the testosterone booster, increases testosterone, circulation, hormone balancing. You know, if you look at this again, diindole methane's in there, horny goatweed, love the name of that, Panax ginseng, okay? Really an important one when you look at this form of ginseng about improving circulation to the body. So when you look at, and I've actually called Panax ginseng nature's natural Viagra, so this can actually help on that front. And maca has had a long, long history, as has the amino acid arginine, in boosting the testosterone levels in the body. I've seen with this prep anywhere from a 35 to almost a 50% increase in testosterone levels over the course of a 90-day period. They got to be consistent with it. They've got to use it consistently, and you'll see the effects. So again, you have a lot of different tools that you can use, from Estro cleanse to PSA, to this prep, if we have somebody that does come in, including the omegas, complaining of low testosterone. DHEA comes in various strengths. I don't like to use a lot of excess DHEA, dihydroepiandrosterone, but if you do look at the testosterone production in the body, if you look at the chart for the conversion, the chemical conversion into testosterone, DHEA is 1 step away in the natural conversion. So when we look at using this, supporting your adrenal functionality, supports estrogen levels as well as testosterone levels, And again, the key word, healthy aging. When you want to get yourself as healthy as possible, verify the levels. It's very easy to get this out of saliva testing. Verify the levels and then dose accordingly. 10 milligrams is usually enough. Even though the levels may be low, I have found that if you stick with 10, and I know there's doses that go to 25 or 50, I still like to stay on the lower side of this so that you don't overdo cortisol production. If they have low cortisol in the morning, it's a great thing to adjunct that. But if the cortisol is already higher at night, you got to be real careful in using a high dose of this. Iodine Plus, we were just talking about this. Tracy and I were just talking about the importance of this. You know, as we've transitioned away from iodized salt, which was our only primary source of iodine in the body, and the importance of iodine in the conversion of thyroid hormone, T4 to T3, one of the most important entities that you can have. So the typical thing that I see in my practice are the more difficult cases. I had one yesterday where a woman came from her endocrinologist. Her TSH was 10.8. And the doctor said, I'm not going to treat that at all. Her T4 levels were low normal. Her T3 levels were extraordinarily high, which didn't make much sense. But when you look at something like that, and the first thing that you have to suspect is an iodine deficiency within there. Something's affecting the hormone balance and conversion in the liver. So I started her on a liver supportive as well as Iodine Plus twice a day. I'm going to run that out for, again, a period of time to see if her TSH will come back on its own. She had enough raw material being produced, but we got to make sure that the levels will come back because her endocrinologist did not want to treat her. But iodine, again, in my opinion, one of the most underutilized preps on the market, safe to use, and since it's estimated that almost 60% of all women past the age of 40 are having thyroid difficulties, this becomes an important factor. Thyroid Complete, safe to use. I have patients that take this simultaneously with their levothyroxine or their Armour Thyroid. I use it as a supportive for, again, the conversion of T4 to T3. There seems to be a very big problem there in the conversion factors, and T3 levels are traditionally lower. So this helps us to get higher levels based on whatever medication they're on or what their thyroid's currently producing. And with the high levels of thyroid difficulties anymore, this becomes almost a standard for any female over the age of 40. Does an amazing job of helping with conversion. A lot of people have asked that question, where did it come from? Where is the thyroid that's in here? It's bovine, New Zealand freeze-dried glandulars, the cleanest in the world. And again, the reason you're able to do this without a prescription, it has no active T4 or T3 in it. Okay, that's needs to be clarified. But this does support the gland itself. So it's almost as if it's food for the gland itself, so the gland can start to produce more T4 on its own. Oxidative stress, Rust-Oleum, free radicals, unstable molecules that have been implicated in all disease states. We had a discussion last night sitting with our feet in the water that I remember. I don't remember a whole lot about last night, but the subject came up about superoxide dismutase, SOD. What's the deal there, you know? And catalase and cellular rust, well, the body naturally tries to stop this from occurring. You know, the next slide is a chain link fence that's rusting. That same concept can happen in the human body. 5 signs that I wrote down that there's cellular oxidative stress going on in the body. You ready? Fatigue, number 1. So oxidative stress can be a precipitating factor toward the thyroid problem, toward a hormone imbalance, toward low testosterone, etc. Memory loss and or brain fog, muscle and or joint pain, wrinkles and gray hair, decreased eyesight, headaches and sensitivity to noise, and a susceptibility to infections. All those related to oxidative stress or cellular rust. Now, we can go back to Frontier Multi, we can go back to the Women's Multi, all those are phenomenal to put in. We added this one into here, 2020, because of its eye protective nature, but this is also a very powerful blend to stop oxidation. It's called 20/20 because we want to stop that from occurring in the eye, in the retina. So we want to make sure that that back wall of our eye, the retina, stays in the shape that it needs to. Retinal detachments are getting to be a bigger and bigger problem. Concussion injuries, dislodging that problem. So again, using a prep like 20/20, I love the name of that, it's so simple. It's something that supports eyesight, but it's also a very important antioxidant. Even if you just have somebody with fatigue, and they're already on the multiple, adding this in can give them a level of extra energy that can help them get through their days. Immune dysfunction, chasing your tail. An aging body loses its ability to attack bacteria. Excess cytokines are produced in aging that causes the immune system to turn on its host, can create autoimmune issues, rheumatoid, lupus, etc. Autoimmune diseases last year, between 2018 and 2019, took a 38% jump. 38% increase in autoimmune problems in this country. Rheumatoid arthritis is at its all-time high. We're seeing more and more cases of lupus, which we didn't see many in the past at all. So when you look at that and say, like, how can I balance this off? You know, my nickname when I was back in school was the gut guy. I will start, if there's an immune dysfunction, by settling the microbiome. GI Complete is my #1 selling product. My #1. I use it in virtually every single condition. I'll use it twice a day for 30 days, then go down to once a day for another 30 days. I'll use that on a regular basis to make sure that I am calming down the production of cytokines in the body. Where are they being produced? Primarily in the small intestine. So if I can settle that part of the body down, I'm supporting the immune system. Part of the immune system support that we did, even with the COVID concept, was Immunimax, capsules and chewables. I love the chewables. I have a bottle right now on the shelf where my girls work at the checkout counter. And every day when they come to work, they take one. They asked me the question, do I have to wear a mask? And I left it up to them. But again, they're coming in contact with the public every day. And I said, I want you to have one of these, at least one every day. What I like about these is they are safe enough to go down to, I just use these a half twice a day with my 4-year-old granddaughter. She came home for the first time with a sniffle. She's 4 years old, hasn't missed a day of school in daycare. Hasn't had a cough, a cold, a flu shot. Now she did go through her vaccines. We started her at age 12 months. And her immune system, she's been on vitamin D. She's been on Immunimax on a regular basis, especially going into the winter. And she's been on fish oil and probiotics since the day she was born. She was a 6-week preemie. And she's now exceeded every one of her growth factors and has not been ill at all. My grandson, who is now 7 months old, from the day he came home, I was there when he was born back in February, and we started him immediately on probiotics, vitamin D. He was 2 days old. He started on 400 IUs of vitamin D. And very shortly, when he turns 12, I'm going to take him up to 1,000 IUs. So at 12 months, I feel safe enough to use 1,000 IUs. But he can't chew yet. But mom, she's still breastfeeding, can use these, and it will support the immune system right through the breast milk. It worked really well. Excitotoxicity, excess levels of glutamate in the brain. You know, this fends back to the MSG concept in the past, which is pretty much gone now, but it's still there in a lot of different foods. Anything that says flavor enhanced is more than likely a glutamate derivative, an MSG. I had just sent Jamie an email that I got back from a patient who was extremely life-threateningly sensitive to MSG. And we had sold him the Pro Reds. He says, does this have MSG in it? And I sent Jamie an email. I forwarded this fellow's email to him, and I'm talking about Jamie responded in minutes. None of our products have MSG. So I forwarded that to the fellow, and he's been very content. He's using it, and he's getting really good results with it. So, excitotoxicity, doing glutamate levels. Now, dopamine's in here too because dopamine is the pleasure hormone, and it's also stimulatory. So when you look at the various tiers of the 16 neurotransmitters that we have, 8 of them stimulatory, 8 of them inhibitory. Medicine is focused on the inhibitory side by using SSRIs, SNRIs, the medications that are trying to boost serotonin levels on the other side. But we oftentimes don't look at this. Glutamate levels linked to brain dysfunction, memory dysfunction, sleep disturbances. When we have excess glutamate in the brain where I can't shut the brain off at night, and also ADD and ADHD, which we're seeing even in adults nowadays. So again, doing levels. If you look up the work of Dr. Russell Blaylock, he's written entire books on excitotoxins. That was the name of his book. Things that we are exposed to in the environment that can cause the potential for problems. I'm just going to go through this one real quick. And again, you want to calm something down? Branched-chain amino acids. I'm going to tell you just a little story of a patient of mine who I talked to yesterday. We did a Zoom face-to-face. She lives in North Carolina. 67-year-old woman who has had a history of depression and anxiety. She attempted suicide 4 times. She has now had her mother moved in with her to maintain things. She's had 2 husbands that both have passed. And yesterday happened to be the anniversary of the most recent death. Okay, now a month ago, we did neurotransmitter levels on her. Okay, and the first thing that I saw was her GABA levels were extremely low. And I got to tell you, if you haven't used Calm Day with your patients, as far as a supportive, with her I was using 4 a day. I was using 1 every 4 hours, every 4 to 6 hours during the day as a supportive. Worked wonders, calmed her down dramatically. But a month ago, I started her on this, branched-chain amino acids. Why? Because this is the fuel that's necessary for the production of all of your neurotransmitters. But the nice thing is, it's an adaptogen that when you start consuming branched-chain amino acids, which is what most weightlifters do, but when you use BCAAs, it's going to put it into a spot in the body where it finds it to be the most necessary. It's not going to boost glutamate levels higher, but if the serotonin's low, it's going to start boosting serotonin. So 30 days ago, I started this young lady on this. And I said, how are you doing now? Her name's Tracy. And she said, really good. She said, I took the first dose of this and I felt it in my brain. I felt it in my brain. And she says, I did what you said. I took it once a day for a week, and then you went to twice a day. I've only had to use Calm Day at bedtime now to help her sleep. And yesterday was the 27-year anniversary of her first husband's death, which was typically take her down. And she said she's doing so well now that her mother's going to probably be able to go back home. Her mother's 90. She's going to probably be able to go back home. So I've seen tremendous success on using this to calm excitotoxicity in the body. So if you have somebody that is stressed out to the nth degree, start them on Calm Day, settle it down, do neurotransmitter testings if you can, and then follow that up with BCAAs. Does an amazing job of help. Okay? Circulatory defects. Open up the spigot. Major mini strokes, cataracts, macular degeneration, and glaucoma. So this is going back to Jamie's point here with 2020. This problem right here, cataracts at an all-time high. You know, when I just moved 3 weeks ago to Tarpon Springs, and as I was pulling into Tarpon Springs, I passed this massive, which I thought was a hospital, and all it is a cataract surgery for I guess, the number of people that are down here. It's just amazing the rates of cataracts anymore in the new surgical procedures. Again, looking at a circulatory system, cross-section, normal, problem. What are we going to see? Varicose veins, swelling of the legs, tired legs, circulatory problems to the heart, circulatory problems to the brain. Circucor, phenomenal prep. Started using this a lot recently. An amazing form, this activin form of grapeseed extract. But this one in particular, you see the commercials on TV. You know, almost every person that does a syndicated radio show talks about beetroot powders, you know, the energy boosting and the effects that you can get from this. And it does so by giving you excess circulation. So beetroot powder in here, and again, the right forms of folate, arginine, citrulline. And what's really amazing too is hawthorn in here, which has been used for decades for blood pressure control. So if you're looking for something for somebody that comes in and says, look, my blood pressure, I'm on an ACE inhibitor, but my pressure's still, especially the upper number, the systolic number is still higher. This can be an adjunct to a blood pressure pill to actually adjunct and bring pressure more under control. Okay, here's a question for you. What's the #1 section for sales in the average CVS, Walgreens, Walmart, et cetera, in the pharmacy area? What's the #1 area for sales? #1 section for sales in all pharmacies in the United States is antacids and laxatives. #1, antacids and laxatives. Plop, plop, fizz, fizz. We all want to medicate immediately if my tummy doesn't feel well. And over the last number of years, with the high levels of stress that we've all been under, one of the first deficits that we see is the inability of the body to produce sufficient enzymes for digestion of food. Your pancreas plays a role, making amylase and lipase. Your liver plays a role by producing bile into the gallbladder. How many people do you know that have had their gallbladders removed? It's a standard of care the minute there's the least bit of congestion within that part of the body. How did it get to be such a congested part? Poor diet. Poor diet. So again, the #1 selling prep in most pharmacies now is Prilosec OTC, omeprazole. We suppress the stomach acid. What's that do? That puts an excessive strain on the liver to make more bile, excessive strain on the pancreas to make more enzymes. That's going to affect your blood sugars and your digestion. And the first thing that you're going to notice is, I'm going to start gaining weight. So the use of PPIs, as we get older, the liver gets more and more of a difficult time producing bile, and the pancreas gets to have more and more issues producing the pancreatic enzymes. Malabsorption syndrome gets to be a biggie. I'm eating properly, and you'll see so many people that you see that you can't figure out why they're so depleted on so many nutrients, but they're eating a clean diet. Look here, because this particular prep, Cybezymes, has been my go-to for that particular issue. When you have malabsorption syndrome where people are just complaining, I eat something and it just seems to stay there forever. I ate something and it's still in my stomach a couple hours later, or I'm still burping, or I get bloated. Ask them again, where's the bloating? Above or below the belly button? Where is it? So if it's staying right at the belly button level and we're getting distension above, go to. 1 or 2 before each meal. Now this can be a great adjunct because I will use this along with Probezymes. I'll use Probezymes for breakthrough times if they're having an issue, if I'm trying to get them off their PPI. But using Cybezymes because the average American now, past the age of 30, especially men, are so depleted on enzymes, we've just learned to accept it. We're bloated all the time. We're gassy all the time. Just ask your wife. So again, using something like this can be a great adjunct. It does give you, which is really intriguing, Bifidobacterium longum. If you have a chance just to Google search that particular strain of Bifidobacterium and the support that does for gastric emptying. So when we have people that have this issue called gastroparesis, where food is just staying in the stomach too long, this can help get it in, get it metabolized, and get it out in a quick period of time. Betazyme, the sister product. This puts betaine into the scenario. So if somebody has been on a PPI, we've shut off our acid production in the body. Keeping in mind, when you use Betazyme, this will feel warm. Take it before a meal, 5-10 minutes before a meal with a little bit of water. You'll actually feel it go down almost like a shot of whiskey. kind of thing, a nice warm feeling in the tummy, because the betaine is going to try to teach the parietal cells how to produce hydrochloric acid, not too much, but just enough so that we can digest our food better. We also have pepsin in here to support digestive tract function and nutrient absorption. So again, two particular go-tos, and when I'm going to put somebody on these, I will typically shift the probenzymes to as needed. Non-digestive enzyme balance, breaking it down, systemic enzymes. Aging causes an imbalance in the liver and the brain. This is where you see things like Parkinson's, which is at an all-time high. All-time high. We used to have virtually no cases of Parkinson's in this country, and now it's surging. Proteozymes happen to be that kind of enzyme, keeping in mind there's about 2,000 enzymatic reactions that take place in the human body every minute of the day, 24 hours a day, from the time you're born to the time you die. So enhancing digestive, non-digestive enzymes can make a big difference. This is where I really like probenzymes. Trying to bring the balance in. They can be used in a lot of different ways, but using these on a regular for digestion, regulation, and immune system support, this is my go-to. The last section here, who invited the cow to dinner? The toxic burden of milk. I was talking to a few people beforehand about my thoughts on this. I haven't had any dairy outside of last night. I had a few pieces of cheese, and I didn't sleep well last night, but it was the cheese. Yeah, it was the cheese. I think. We're the only mammal that suckles from another mammal. Let's just put it to you that way. Cow's milk is technically not acceptable to human digestion. There it is, period. You know, I've actually had farmers threaten me when I was doing the syndicated radio show saying, you know, you're killing us here. The dairy industry is one of the biggest, most powerful bloc to Congress in the United States. They're still getting their little half pints of milk being sent to every school in the United States. Our little kids are getting these, even though the statistical data has shown that the calcium content of that milk is actually being depleted out of their systems because of the acidic nature of the cow's milk. So they're really not absorbing any calcium. So they said for years, this is for strong, healthy bones, but it really wasn't. This is in there, and you can look at this just to compare. I did a comparison of one a day, and I put this in as a promotion of what Jamie's doing for me. That's my Frontier Multi. I simply call it dailies. So Jamie helped me develop a label for my product, and that's what it looks like. So I now have been developing the Nutrition Shop line of products in conjunction with Jamie. So talk to Jamie or one of your reps if you want to get involved in private labeling. They do an amazing job of this for you. And again, it does help to get that customer to come in and stick with you. The one thing I like about Jamie and his products is that I don't have to worry about Amazon. You'll see them on there, but the prices are solid. Jamie does a great job of looking through all of the sites that are out there to make sure that nobody's undercutting the price. And if they do, he won't sell it to them anymore. So there's an ethical thing there which is really important. But if you can compare, and I have it both on there, if you really want to blow it up and just compare ingredient to ingredient, it's amazing you'll see the difference. This is the chart that I wanted to really get into, and understanding that when we're looking at testosterone levels for men, right here, we see that it can go back and forth to andro, and it also can go to estradiol. It does not go backwards to DHEA or progesterone. So when you look at the chemical structure of cholesterol, it is a 4-structure saturated with oxygen. And when you look at the chemical structure of cholesterol, once it enters the bloodstream, being produced, 90% of your cholesterol being produced by the liver as a source of these hormones. Immediately upon entry into the blood, right here, it loses an oxygen, and a hydroxy group takes its place. It's a simple chemical conversion that puts it at site O3. So 3-hydroxy cholesterol is pregnenolone. Again, a lot of people use pregnenolone as a source, natural source of progesterone. So when you look at this, you can go down through the transition that every one of these, from andro to estrone to estradiol to estriol, all have the cholesterol basic chemical structure. So again, in a world where medicine has seen this as something that's bad, and we have everybody on statins, and we're trying to lower that cholesterol, and this is a fight that I get with a lot of doctors. You take the cholesterol level below 150 in the blood work, your hormone levels are going to tumble. So again, somebody asked me yesterday, give me a natural food for testosterone production. I said, eggs. You want a natural food to adjunct with the diet? Get the cholesterol, higher cholesterol food, which is eggs, and start consuming it on a regular basis. You also see out here that the adrenals play a controlling factor for DHEA and progesterone. So under high periods of stress, this gets back to the Adrenamax concept of supporting adrenal functionality so that it doesn't interfere and it cooperates in this production. Here's cortisol, which is an offshoot of progesterone. Here's aldosterone. So this, again, is another one that looks at skin tone or acne in a teenager. You can look at it of using the right blockades to stop this from occurring. And again, it gets back to that estro cleanse. Down here, you've got the E2 and E3 going back and forth to each other, and estriol. And you're going to hear much more about the female side of these hormones this afternoon. But here's one of the biggest problems that I've seen is that men are aromatizing their testosterone into estrogen due to a bad diet, lack of exercise, getting excessive weight on, and all of a sudden the estrogen levels start to go high. So if you can block this, you do an amazing job of supporting their testosterone levels. And again, there's the Frontier multivitamin in the Women's Complete. I got to tell you that this right here, and you're going to hear much more about that this afternoon. These are from the Men's Health Network. You can find these online. There's some great little adjuncts to keep when you do your consulting times. If you have those right there and you go to page 2, the current state of men's health, which is life expectancy as of 2014. I want to make sure you see that page because one of the reasons we did this seminar is based on this. Because if you look at all males in the one column and you see the life expectancy in 2014 was 76.4. 2019, it's 71.6. We've lost almost 4 years of expected life in the last 6 years. Something's gone wrong dramatically. So when you have a life expectancy of a female at 81.2 and a male now at 71.6, it's almost a 10-year differential for us guys. And the problems go into that, and you can see this here, why men don't make doctor visits, how much stress is too much stress, what is anxiety, and how to deal with it. So there's a lot of great handouts in here that you can use. The Men's Health Network allows you to make copies of these and pass them out. Some amazing, easy way to use these in your consults. So hopefully you can utilize these, take a look at them. There's a lot of great information in there. All right, well, thank you very much. And any other questions?
Hi, I'm Jamie Dorley. I'm CEO, co-founder, and owner of Nutritional Frontiers, and we're breaking through nutritional boundaries. I'd like to let you know our mission is to make the world healthy, and the best way to do that is share our education. We like to welcome and invite all doctors, healthcare professionals, and staff to our professional training events coming to a city near you. You can attend these live, you can go virtual, or you can get the recording. Any way you like it, come and join us for a professional training event. We have fantastic speakers, great topics, and a really enjoyable atmosphere that is fun to learn, and you can take these principles you learn back to your clinic to help you improve your patient outcomes and increase your practice profits. Thanks so much for all the support. Look forward to seeing you at a professional training event coming soon.